but it's lifestyle, right? And it's like, traditional medicine, you go in, maybe they draw a couple blood panels or they do something real basic, and then they just recommend something like a medication. Where a lot of docs can go wrong with functional medicine is they think they're doing functional medicine because they're drawing your blood and then they're giving you supplements, but it's literally just the same model, just with natural interventions. Okay, so it's like a little bit better, but it's still missing the piece of the why and like the root cause. And so like, yeah, if you're chronically stressed out because your life is just madness, then like I'm going to dig into that a little bit.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Hey, Health Decoded listeners, Dr. Alessi here. Let me ask you a serious question. Are you tired of waiting until something goes wrong to finally see a doctor? At Alessi Functional Health, we take a different approach, the right approach. We believe true healthcare isn't about chasing symptoms. It's about preventing them in the first place. That's why we created the Alessi Total Care Program. This is a functional medicine-based membership that gives you proactive, personalized care year-round. You'll get access to comprehensive blood work and functional testing, custom doctor-grade nutraceuticals, deep discounts on labs, protocols, and follow-ups, as well as 24/7 direct access to your doctor, not just a 10-minute checkup that ends with another prescription. And here's the best part. As a Health Decoded listener, you'll get your first 3 months completely free when you sign up for an annual membership. That's on top of hundreds in savings already built into the program. This is your chance to take responsibility for your health and join a movement that's redefining what primary care should look like. Head on over to alessifunctionalhealth.com, click on our services tab, and go to Total Care. Learn more about this program and claim your exclusive podcast listener offer. Your health is your greatest asset. Let's protect it proactively. Welcome back to another episode of Health Decoded. I'm your host, Dr. Alessi.
And your co-host here, Matt Tack.
Matt Tack. Man, coming in hot. How we doing?
Good. How are you?
I'm doing well, man. I'm doing well. I'm excited. This is it's a good day. It's been a good month. There's a lot of cool things happening within the clinic and kind of what we've been doing and these programs we've put together. And it's really cool to see, people are like excited about it, right? Like patients coming in the office and they're excited to be there. They're excited to learn. And it's just awesome, man. I feel like, it's really like a health revolution that we're seeing nowadays. People like wanting to take control, right? Wanting to get ahead of things. And we talked about that a couple weeks back, is like the proactive versus reactive, right? And I think people are understanding the importance and actually starting to subscribe to that. So it's been good, man.
Yeah,
What's new with you?
It's control, right? At the end of the day, like people, when you can have some element of control over your life, it's empowering. And I think that's what, like, ultimately you're giving to somebody through the process of the education. When you can have control over what you're putting into your body, it's a beautiful thing. But
yeah, that's awesome. I literally just talked to a patient yesterday, and we're sitting in there in a functional medicine consultation, and I'm like, hey, the goal here is for me to teach you how to read your own blood work so that in the future you can run labs on yourself, you can see what's going on, you can stay ahead of things, and then I'm here to guide you if you need help, but you can tweak things as you need as well, right? Oh, it looks like my cortisol is high this month. Oh yeah, last month was pretty stressful. Now what do I got to do, right? I got to change up some things, maybe in my daily routine, maybe in my sleep, maybe in my lifestyle. So being able to get the knowledge base there, because most people have no clue or how to read lab work. And so it's really important. It's like, you're going to just rely on someone for that forever, or can we guide you to then, like a teacher, give you an idea of how to do it for yourself? So we're all about that.
Yeah. And look who the guinea pig was, me.
I
was the first functional medicine patient, I think, at, I won't say the first, but I was a guinea pig in that person of like, hey, I want to learn more about what's going on. Like, what are my symptoms, and how can we get to a root cause of this? Because I want to feel better. And so we did that. You guided me through that. We dug in. And I just constantly want to learn more and more now. right? Put new habits in place, dialing in nutrition, micro supplementation, and then even understanding my blood work. Like I'm able to educate people on blood work now because of the time that you
Yeah.
took to just basically take me through hey, this is what this means. And this is how we basically need to put the micro supplementation together. And then maybe let's look at your habit structure. And so all those things really do play a huge role in an understanding of, hey, how do I just feel a little bit better tomorrow, right? And it's that 1% improvement.
Yeah, yeah, that's awesome. And now I don't even look at your blood work really anymore. You run it yourself and you do it yourself, and like, it's awesome, man. It's good stuff. And so I think you took initiative, right? Like, that's a good point, is like you took action on that and you were very proactive about it. You're like, man, I want to learn these things because you do care about your health, and you are, very much focused on that, and not just for you, it's for your family too. So that's what we're trying to create, man. Again, you're like the role model for our patients. So today we're unpacking the 3 pillars of health, we call it, right? That basically is like the foundation of how we help people, how we get great results without relying on pills, and really like guesswork is what we call it. Like a lot of places, a lot of docs you go to, and it's like guesswork. They just, oh, let's try this medicine. Let's see what happens. Come back in 6 months. That's pretty, basic and honestly fruitless. So really, like, our mission statement, and I'll just read it here. Our goal is to educate and empower you to take ownership of your health. We believe healthcare should fix problems at the root, not just mask symptoms. And so that's really what the 3 pillars are built to do. And so when you kind of came up with the idea for this episode, I was like, heck yeah, let's do that, because we want to let our patients kind of know like how we operate. Obviously, they've probably been to the clinic, people listening, or they've, met us at some point and they know what we do, but like the foundation of how we operate and why. And I think that's really cool. And so, yeah, we do have these 3 pillars, and it is important because it's like a roadmap, or it's like a guideline. And so unless you have like structure in place, you're going to be all over the place. And so why don't we just go through them and kind of, we'll just, keep this open conversation, man, and talk about stuff, maybe talk about like experiences we've had and kind of what it is, explain some of this, and then, keep this fun. So I'll do this. I'll just start it. Number 1, the first pillar we have is what we call physical medicine. And so, think of your body as a house, right? If the foundation of the house is crooked, everything else is going to suffer. And so the first pillar is what we call physical medicine. So think of your body as a house, right? If the foundation of the house is crooked, everything else is going to suffer or have issues. And so pillar 1 is really about the structure, but then also the function and the movement of that structure. And so there's a few different key components, and let's just kind of get into this, right? Number 1, and patients who have experienced this know, we practice what's called chiropractic biophysics. And so this isn't just routine adjustment, pop, crack your back, oh, I feel better, see you next week when it comes back, right? This is correction based. And so it's not pain based. So yeah, you might have pain, but why are you in pain? Because your spine is far from alignment, or you have a reverse curve in your neck, should be bending this way, it's bending forward, right? And so these things over time, these structural spinal changes lead to degeneration, lead to arthritis, and ultimately lead to pain. And so we're very focused on that because we get better results than anyone else, because we take that extra added step to focus on the corrective, not just the, let me get you out of pain for the week, see you next week, kind of, I guess, routine, right? And you kind of experienced that too in the past with some chiropractic care you did.
Yeah, for sure. And I think that's one of the big things of just the biophysical element is the ongoing maintenance of it, right? So, a lot of people think of it's like an acute, hey, I have an acute injury or something happened and that's my lifeline, right? And I just don't treat chiropractic care that way. I treat it as like a long-term maintenance, proactive type healthcare approach for me, because I take my body through a lot, on a daily basis. I still play sports. We were talking about sports before this episode, right? We want to play sports as long as physically possible. And I think we're able to do that. But we have to take the proper measures, and the chiropractic biophysics, along with the other therapies that we have, are instrumental in that.
Yeah. Well, it's like, what other things in life do you ever just like do it once? And it's, you know what I mean? It's like to maintain results, like you got to have some level of like effort in. Exercise is a great synergy to it, because you go to the gym and say you're more dialed in routinely at the beginning. Maybe you're going 4 or 5 days a week, really with a goal in mind. You get to that weight, then you got to maintain that. You don't just stop. Right. And so, but the cool thing is with the protocols we use is we do get really good permanent results. The patients just have to maintain that on their own, right? It's like you come to us for a fix. We fix whatever problem it is. And now it's up to you. Like if you maintain the things we've shown you, which a lot is done at home, come in for an adjustment maybe once, twice a month. But other than that, like you can maintain a lot of these results with the structural things we teach you, the orthotics, like the dental roll is an awesome tool, and even like exercises to mitigate having to relapse and then end up being more on a corrective program again. And so it's like the phases of care that we often see with the physical medicine side is like very much like people come to us with pain. So there's like that acute pain relief phase that they got to go through. We got to get you out of pain. That's why you're here. And it's limiting things. Usually that's pretty short, man. That's 4 to 6 weeks is about average what we see. We get people out of pain pretty quick. Keeping them out of pain is the hard part. And this is where a lot of chiropractors don't have like an answer or a plan. They just keep doing the same things. And so it's like, that's where we build in now the next phase, which is like the corrective phase, right? The corrective phase is what keeps people, what actually makes structural change in the spine. And so some of the instruments we use in the office, which, you can talk about, but that's where we get like actual change that is visibly seen on like an x-ray. And then from there, it's the maintenance like you were just talking about. And so why don't you talk about like some of the chiropractic things we use in the office? Obviously, the adjustments are things that we have like Dr. Rennie doing adjustments. I do some adjustments from time to time. But like the protocol, right? And like what it looks like to do a corrective plan.
Yeah. So when Dr. Alessi actually came up with this, complete phased out protocol, it's been revolutionary in terms of like how we care for our patients and actually take them through the lifeline of what maybe an acute injury might be, but also like the maintenance on that maintenance side as well. So what we have primarily right now, outside of our other 3 pillars, but specifically just within our protocol, is soft tissue therapy, which is our soft wave therapy, which is essentially is kind of targeting acute areas, mainly that fascia, that soft tissue, tendons, whatever it might be, and in the spine, right? So the central nervous system is going to feed back on any level of inflammation, but the soft wave technology basically kind of like artificially targets, not kind of, it does, targets in that area of inflammation and throws stem cells at it. So naturally produces stem cells in the region that it needs to. So we can use that in spinal regions. We can use that in shoulders or knees or whatever it might be. So it's a beautiful thing and run in combination, especially like with a sciatic injury, where you're going to be feeling that in that hip, lower lumbar region all the way down to potentially your ankle. So we can utilize it for that to reduce the amount of pain you're having in one region, while we're adjusting through spinal decompression your spine, right? So that's kind of the structure of the elongation of the spine, giving room for those discs in the chiropractic biophysic phase to be put back into place. So that's what I love about the 3 things that we use in terms of the protocol, is because they're also utilized very specifically, but they synergize together. So the 3 things we obviously do is soft wave therapy, spinal decompression, and chiropractor biophysics. So that's it. That's what we call affectionately the pain-free future protocol.
Yeah. And so essentially it was where it came from is, I've been doing this for going on 6-7 years now. And I've always been chiropractic, right? That was where I started. It was adjustments. And I was like, all right, there's help people more? And then I worked in a clinic where we had spinal decompression. I was like, okay, this is awesome. Like, this is now getting people fantastic results with disc injuries, because before then it was really more like passive stretches and stuff like that. And then 3 years ago, investing in the soft wave technology, I found that we can take a disc injury, which discs are very slow regenerative, so are nerves. They take a long time to heal. And if there's compression on it, it's going to take even longer. And so normally, we are looking at somewhere around like 6 to 8 months for like a full recovery. We're accelerating that with the soft wave, somewhere between like 3 to 6 months. Patients are getting awesome results and like permanent results, right? And so basically we took that plus the corrective chiropractic plus the spinal decompression, those three things, bundle them together. It's like, now it's like a home run, right? That's like that summative effect you get of all these modalities. And so then we're like, okay, like let's put a name on it, because a protocol is always better. It's like, hey, we follow this protocol, we get results. And so it might look mildly different from patient to patient, like how many treatments they'll need, like the severity of maybe the neuropathy. But for the most part, it's going to be heavy with the soft wave and decompression on the front end, phasing into more of the decompression and corrective chiropractic in the mid, and then on the back end, the maintenance chiropractic to keep the results. And so you go through this protocol and these phases of care. And again, it's just, if you do it and you do kind of how we instruct it, it works. Like it just, I want to say 100% of the time, but I can't, but like it's going to work. Right. And so again, there's always that buy-in component. Like some patients fall off or they get distracted, or life events, right? Like they have something come up, and so 100% would be nice to say, because we do get in the high 90s success rates with our protocol if you do it correctly. So then let's go into kind of the next piece of the physical medicine, which is the spinal decompression that you mentioned. So spinal decompression is basically, it's like a bed. You're laying on it, either on your back, or sometimes you can go prone, but it's mostly on your back, and it's pulling your body axially, so like straight, versus like some other therapies, they're going to flex your spine. When you pull it straight, think of like, the example I use is like a sandwich, right? Say you got like 2 pieces of bread and you got a bunch of deli meat and avocado and stuff in there, and you squish it, everything shoots out the side, right? That's like the disc pushing out. You can't just stuff that back in. You have to open that sandwich up to let that the contents come right back in. And that's kind of the crude example for like a spinal disc, is like, if we can open that up, naturally the disc wants to go back into where it came from. And then with the therapy, the soft wave and stuff like that, we can then let that heal. But as long as it's being squished, that thing has no chance, right? So we have to do the decompression to alleviate that.
Yeah, I think, and that's both obviously in the cervical and the lumbar. So the table's actually positioned appropriately based on where you're seeing the compression in your discs.
Yeah. And it's awesome. And it even if you don't have like severely herniated discs, it just feels good too. So you and I are on that thing pretty regularly.
Dude, at least once every other week. I mean, that's
perks of the job,
part of the reason of you utilizing it for kind of the ongoing maintenance component, right? Because naturally over the course, there's going to be something that happens through either the playing of sport or working out that you just generally need it. So it's that maintenance portion that's extremely critical.
Yeah, that's a good point. A lot of patients come in and unfortunately they've gotten themselves to a point where like it is pretty severe. And so like, yes, we do get them great results and we get them out of pain, but it's like, hey, maintenance is going to more than likely be something you need to do. Or we're going to highly, highly recommend, right? Again, optional, always optional, but gravity and the way we sit all day, it just puts pressure on the discs again. So discs are tough, man. They're not easy to deal with. You take a spinal disc injury to an orthopedic surgeon, they're going to tell you the only fix is surgery. Obviously, they don't know the kind of stuff that we have, so this is out of their wheelhouse. But when we do it right, again, we can heal that. Then it's a matter of like maintaining that over time. And so that's where like kind of the next part comes into is like the strengthening piece, right? And so we very much focus on strength. I'd say our population of patients tend to be maybe 40 and above. And so how do we build up a level of core strength and deep strength that's going to prevent further injury, make you more resilient, right? And prevent, obviously, relapse and these things happening again. Because what we see is it's not like you woke up one day, your spine was perfect, and then your disc just explodes out the back. It doesn't happen that way. More than likely, people are walking around with some level of disc bulge or compromise that's it's there, it's waiting for an event, right? And then maybe the event's a car accident. Maybe the event is you fell, or you picked up your kid and your kid moved weird and you twisted, right? It's always something super random. And then boom, that disc just pushes back, hits the nerve, and now you're in excruciating pain. And so, okay, how do we like fix that, but then like bulletproof your low back, right? And that's where we use a lot of the exercise piece. So functional movement screens is awesome one that we use. It's very focused on like that deep core. And then again, like building up those like functional patterns too. So you're a big component of, or a big proponent of the deep core. And like you do core work twice a day, every day. I mean, you're just like so focused on it, and it's more than just a six pack, man. It's like, how does your deep core actually keep you healthy?
Mm-hmm. Yeah, I mean, I do. And one of the things that, is really big is when you're able to, and it's not just like the core work, it's the postural stuff that comes along with that, because you notice that when you don't have a strong core, you're rotating those shoulders over when you're sitting down. And a lot of people are sitting down for work, right? And that's where that tech neck comes into play, because when your shoulder starts becoming rounded, your head starts becoming rounded. And what we look at, as we see Hannah doing all these like x-rays and writing up, how straight these necks are getting that come in every single day to our office of these x-rays. So that's one of just the major things is when you have a stronger core, you're naturally able to hold yourself up a little bit straighter. And you don't have that roundedness to your body, which you can see that as you age. I see that even in my dad has a very rounded postural look, and that's just over time has naturally like keeps going forward right now at 70 some odd years old. So that naturally happens unless you aren't cognizant of it in building strong core related activity. You can't really put yourself up. And honestly, I think it, neurologically, that's a confidence thing too, right? We can do a whole other episode on this, but like portray somebody that has this like kind of rounded figure, right? And then like how you perceive them and their level of like confidence when they're rounded like that. But if you can sit up straight, you're almost like your chest is coming out, your appearance, takes on a much different look. So that's just being extremely candid, is that you're like your brand to somebody else, when you're like this versus your shoulders are straight, says a lot about you. So, that's what we want to build your confidence up along with everything else. So the structural exercises are equally as important, but they are more at home based, right? So they're relied on something that we can control as in-clinic activities. Then we send you home with exercise activities. Those tend to become a little bit harder, but man, are they important.
They are, yeah. And like the cool tools that we use and stuff. But you made a good point there, because when you're in that rounded posture, there's obviously the mental, emotional kind of component to that. Like you maybe like exude less confidence or feel less, but there's also a physiological component to that, is you are compressing your brainstem and your spinal cord. And so the flow between the brain and the body is diminished, right? And so that can lead to that, right? Less feeling of like energy and stuff like that. And you feel more kind of, I guess, off or down, or you have less vitality. And so it's very much a physical and a emotional component to that. That's actually pretty cool. So yeah, I mean, again, the concept with the physical medicine piece, and really which was like the foundation of our practice and where it all started with me was, this is the pillar where we focus on obviously getting rid of pain, keeping you out of pain, but then improving function as well. But it's really just a piece, because then there's oftentimes patients who come in and we have to take it deeper. It's like, hey, yeah, you have chronic pain, but your body seems pretty inflamed, right? Like, why are you so inflamed? Oh, like you have this massive brain fog, and now you have all these digestive issues too. And there's more to the puzzle, right? And like, we're not just a bag of organs, right? Like we're a system that functions in unison, in tandem. All these systems have to be talking and communicating all the time. The best example is really like the way our hormones work, right? Like your pineal gland secretes a hormone that tells your hypothalamus to secrete a hormone that tells your thyroid and your adrenal glands to secrete another hormone that either tell them to do more or less. And it's this whole cascade. And if one thing's off, everything's going to get kind of haywired, right? And so that's where like now, our second pillar really comes into play, which is the functional medicine. And I like this concept and this one because I think this is something that we do really well that obviously Western medicine doesn't. And a lot of other docs who are trying to don't do it either. There's not enough of that like connection component. I think we connect really well with our patients. So, because the truth is, dude, most people don't need more meds. They need better data, right? They're not getting enough data. They're getting a snapshot, which we talked about in many episodes already, a snapshot of what their blood work looks like, and then they're getting put on medicine with this vague information. And so it's all about understanding why, like why are these things happening? Because then once we know why, we know how we can fix it, and then we know what we need to do, right? And so that's really the approach. So why don't we talk a little bit about it, man? Like talk a little bit about like our program, what we call Total Care, and kind of what it is, and the fruition of it.
Yeah, I mean, the antithesis of like what this program is there is a driving force. I think a significant driving force right now in healthcare. I guess we could say proverbially now being known as sick care, right? I think people have figured it out at this point of like what it actually means. And so, and now it's good versus evil. And I'm not going to lie, like, for a long period of time, I think that functional medicine was considered more woo woo, like, oh, they're out there a little bit more, but now it's just good medicine, right? At the end of the day, because I think when you can be more educated about yourself, and this is something that we aforementioned, and I was the guinea pig, right? And so then what does that look like? And what does Alessi Total Care program look like? And basically it's an educational resource, for you to empower you. We want to educate and empower each individual to take ownership for themselves of what's going on internally within the human existence at which they operate, right? And so how do we do that? Well, number one, it's data. Like you have to understand like where your blood work's at. So like that's the first thing we do is a comprehensive blood panel. And so you'll sit down, we'll kind of dig through things, but then step number one is a comprehensive blood panel. So we actually had our phlebotomist come in, and a bunch of people came in yesterday and had their blood work drawn. And so we'll collect data based off of that. We'll be able to read that. And then the next step is really, all right, well, what do we do with that? And so then that becomes like, all right, we have a baseline. But how do we improve this? And so there's going to be a couple different factors. You're going to be able to sit down with a doctor, number one, and you're kind of give that rubric, right? Well, what are my habits? Why would my cortisol levels be high? Why do maybe I have a dysfunctional thyroid? Where are my vitamin D? And what are even vitamin D levels, right? Cardiovascular risk. Oh yeah. Like, how do I understand my cardiovascular markers? And what are lipid proteins at the end of the day? So you might have a lot of questions, and there might be just like some things that we answer along the way, but like all those things come into play of really getting a better understanding of what you're able to do with now the information that has come back from a comprehensive blood panel. So sitting down with the doctors is really just building out habit structures of how you can better align what maybe some risk factors that you currently have. And then number two is maybe some micro supplementation. Maybe you're extremely healthy and you don't need anything, but the likelihood is, I thought I was extremely healthy and I looked extremely healthy, but I was deficient in a lot of micro supplementation. And I get my blood work done on a quarterly basis now. What came back from last time was I had high cardiovascular risk factors, right? Well, I want to get ahead of that game. And what do we need to do to build those into place? So my micro supplementation became a big factor in that. And then how I just adjusted a few things in terms of my habits. I have pretty solid habits, but I've added a few things to help me from a cardiovascular standpoint. One of which is the sauna, right? And that might be a recommendation, but I routinely get in the sauna because of the factor that came back in my blood work recently. So Those are just some of the early steps. And then it's ongoing maintenance, right? So what does that look like? Well, it's likely getting blood work done every 6 months. That's a great way to kind of really have data-driven effects that reverberate off of your baseline. So when you get it done more consistently, you have an understanding of where you're progressing from that baseline. And then what things need to be added in. So you would come in probably 2 to even 3 times a year to meet with either Dr. Alessi or one of our functional medicine docs, really to, hey, to be coached and be disciplined, and maybe some new habits that need to be formed, or new supplementation that needs to be built in. So it's really, at the very baseline of it, it's education. How can we empower you to really just inspire your human existence?
Yeah, that's so good. And something you said there that I want to point out, because I love that you are this way, but it's lifestyle, right? And it's like, traditional medicine, you go in, maybe they draw a couple blood panels or they do something real basic, and then they just recommend something like a medication. Where a lot of docs can go wrong with functional medicine is they think they're doing functional medicine because they're drawing your blood and then they're giving you supplements, but it's literally just the same model, just with natural interventions. Okay, so it's like a little bit better, but it's still missing the piece of the why and like the root cause. And so, like, yeah, if you're chronically stressed out because your life is just madness, then like I'm going to dig into that a little bit. I'm going to be like, hey man, how's your sleep? Okay, your sleep's not great. Let's come up with some habits that are better for you. Let's put the phone outside the bedroom 2 hours before you go to bed. That's going to help, right? Instead of scrolling, right? All these things, right? Like, so the sauna is an awesome one because, again, you took a data from blood work and you did a lifestyle intervention that you can now implement that's going to benefit you in that way. It wasn't just another thing, right? It wasn't just like, let me take more stuff. And so that's the cool part of how we practice, is we call it the lifestyle medicine piece. And I have, a plethora of guides that I give patients. Sometimes I'm like, hey, do you want the whole thing all at once? You want the shotgun, or do you want me to just drip this to you? Because like sometimes it can overwhelm them. We have all these guides, like how to shop for food, right? Like what to look for in your food, detox your lifestyle, what things to eliminate from your home doctor kit, we call it. Like, what things should you have that you can check every now and then? Maybe a blood pressure cuff, maybe checking your pulse ox, like all those things. And so it's like, again, giving them the tools, giving the patient the tools to be the doc, and then like, hey, I'll just be the guide to kind of give you more information and tell you kind of what you need to do. Probably obviously heavier on the front end, but then on the back end, like you do it, right? And so that's the cool part, man. Like, we definitely are changing the model with how medicine is. And when you got into like where this started from, it was like a lot of it was like you and I were having a real deep conversation, and it's like, man, when I became a doctor, I took an oath, and the beginning of that oath is like, first, do no harm, right? That's like every doctor takes that Hippocratic oath, and that oath is being broken every single day. When a doctor sits with you for 5 minutes, here's your thing, and then just throws medicine at you, they are doing harm, because they're not getting the full story, and they're not giving you like what you deserve and what your body really needs. And then they're just giving you a poison, honestly. And so like, I'll be super blunt about that and super forward that, like, yeah, that's harm, right? That is doing harm. And so how many people die? I don't know the statistics, but how many people die from what's called iatrogenic death, which is doctor induced, whether it's a surgery that didn't need to be done and there was an infection, or a wrongly prescribed medication or something, right? And it's crazy. The stats are nuts. And so, I don't want to get too off the rails here with this, but I want to just talk real quick about like reference ranges and how that works, and where functional medicine takes a different approach, right? Like, the best example is like hormones. You look at testosterone in a man, the reference range is like 250 to like 1,000. It is huge. And so if you're like 300 or 350, your doc's going to be like, yeah, you're on the lower end, but you're in range. You're good. It's like, that is insane, right? And so like that range to be optimal, what we call like the optimal or the functional range, is a lot tighter, right? Like functional range is probably like closer to like 500 to 1,000 or even more. Like, we want to get that number up. And obviously it depends on the marker that we're looking at, but again, even like vitamin D, you got like a 30 on a vitamin D, they're going to say you're in range, you're good. ideal scores for vitamin D is somewhere like more like 75 to 80. You want to have that higher level because that is a prohormone, that is an immune modulator, that is a cofactor that does so many things to the body. And so again, taking a different look at it, looking at it more functionally and more optimally of like how does your body actually going to perform? And so like, do you want to put just standard basic stuff into your car so that like hopefully it runs, but like it's not operating great? No, most people are going to take really good care of their vehicle. They spend a lot of money on it. So it's like your body's a little bit more important than your car. I think you get one of them, right? You can buy a new car, but how are we taking care of ourselves proactively in that way? And that's, again, like, not to harp on it, but that's where we definitely I like the approach we take, because when you say it that way, people are like, oh, that does make sense. Like, why wouldn't I do that? Right. It's like, why wouldn't I care for this body I have? So, it's really like the functional medicine builds off of the physical medicine in that it can help with inflammation. It can help with these other symptoms and, more like internal things that are going on within the systems that may be preventing healing on the physical side. If you have all this dysfunction, your body's going to prioritize that versus healing your joint pain. And so then like you're doing all this stuff and your joint pain's not go away. We got to take a deeper look. Hey, what's going on here? Right? Like, how do we dig and how do we figure this thing out? And so that's really good, man. And thanks for saying all that and kind of telling your story too. Let's get into now like the third pillar, right? So we got into pillar 1, 2, the third pillar that we have. And this one it's cool. This is like the cool one, right? It's regenerative medicine. And this is just more like on the cutting edge side of science. Falling into this category is that soft wave therapy that falls into the physical as well as the regenerative, because it is a stem cell therapy. It does help obviously on the physical side too. So it's a really cool system we have. But let's get into, some of pillar 3, which is that regenerative piece, and some of the therapies that we're doing to really, optimize and enhance patient outcomes like nothing else. So why don't you start with kind of like the MSC therapy?
Yeah, this is some of the really cool stuff that is coming along from a regenerative standpoint. But to be honest, is like on a little, this is just being extremely honest, a little bit more on the expensive side. So there's maintenance occurred to this one.
Yep.
But still is a great way, holistic way to really enhance an outcome of maybe an acute injury or just an elongated injury. So mesenchymal stem cell therapy, the stem cell therapy is embryonic in nature, right? So they're pulling the stem cells, but it's injected into joints in stimulated tissue repair. So you can do this both intravenous and you can do it in direct site repair, but is a really, really cool way. So if you have you're having a knee injury, a shoulder injury, maybe even an elbow from playing sports in college or high school for a long period of time, right? Those are some ailments that can help. It also, for the spine, is a great way, right? So like direct injection right in the spinal columns is a great way for these mesenchymal stem cells to approach and enhance just the reproduction of cartilage and joint repair and all these things that are necessary for you to just get naturally stronger, right? So like joints, you only can hold as much muscle as your joints will allow. That's what really people don't understand too, is like your joints are almost more important, and muscle is so important for longevity, but your joints are probably the most important things because those are what's holding on to those muscles. So they're amazing as an anti-inflammatory and regenerative properties. And then they're typically location based. So they're going to be in the spine, the knees, the shoulders. Those are the areas in the region. They also are actually implanted, which I need to look into this. A lot of people are using it for hair. So you actually can get stem cells actually located with your hair for hair regrowth. I'm obviously losing mine, getting a little thin.
I told you I would shave my beard and let you put it on your head, man. I already told you that.
Please do. Our family's looking for another redhead. So, so that's the MSC therapy, which, we do in clinic. which is an amazing add-on. So why I say add-on is you still need to use the structural piece. So the biophysical standpoint of like what we're utilizing in the chiropractic care, the decompression, and even the soft wave technology. So those go hand in hand, right?
Yeah.
Because it enhances the productivity of the stem cells that are location based or intravenous, right? So you want to make sure that you're utilizing both properties. It's definitely, you need to get the structural component first. The regenerative side comes second, but they run in tandem together. So they're really awesome. And to explain a little bit more about what the soft wave therapy, again, those are the acoustic sound wave therapy that stimulate the stem cell recruitment. So as you get injected with MSCs, it's going to recruit more natural homeopathic stem cells in the body to just keep moving at a more rapid pace as an anti-inflammatory for approach. So it's great for obviously the pain, the inflammation, and then extended recovery time, where it shortens the gap to that recovery period, right? So those are some crucial things to know about what we're doing on the regenerative side. And really, honestly, last but not least, what we love is the peptide. There's a number of different peptides that we could recommend that we actually utilize. But if you don't know about peptides, there are bioidentical signaling molecules that promote healing, right? And regenerative repair. So improves soft tissue repair, immune imbalance, metabolism, and even cognition. Some of the examples of like what we've used is BPC 157, TB 500, to maximize, that's more muscular and structural component. And then CJC with blended with ipamorelin. You can also blend all of those together. So BPC 157, you can blend peptides. Typically, peptides are better and best performed through subcutaneous measures, meaning they're injectables, but they also have oral and suppository peptides as well that you can utilize. Nonetheless, I use the sub-Q along with my hormone replacement therapy. I find it being the best, but this is where we go from managing pain to actually rebuilding tissues, and patients love it because they actually feel the difference throughout the process. So that's a little bit about our third pillar in the regenerative side, if you want to add on.
Yeah, well, I just wanted to kind of talk about like what it would look like for a patient. You know, we're running a little long here, so let's not go too much more. But and then the other thing is like the peptides are awesome because, you know, yes, you mentioned stem cells tend to be a little bit more on the expensive range, but obviously massively effective, and that's why. But the peptides are great because they're like a Swiss Army knife. You can use the BPC injectable for joint right in the joint. You can inject it sub-Q in the abdomen for more of a global effect, or you can even take it orally because it is a gut peptide. And so it will heal leaky gut. And so we use that in our leaky gut heal in like 5 R's program, the repair. BPC orally it's amazing. And so it's like next level for healing the gut if there's any inflammation. And so, you know, it's cool because, okay, we just talked about these 3 pillars. Now it's like, what does it look like for someone, right? For like all of those to kind of come into play. And you kind of mentioned it, right? Like say someone comes in, they've got back pain, an old injury, their body's massively inflamed, maybe some digestive things. They could benefit from like one of our like more premier programs or packages where they get maybe a stem cell injection at the beginning, right? They pair that with some peptides maintenance wise. They're doing the corrective chiropractic and decompression with the soft wave over the area. And then on the functional medicine side, we're getting them the supplementations and the nutraceuticals to rebuild joint tissue, right? We use a ton of different really cool products that have nutrients that will go in and actually stimulate rebuilding of the tissue, that synovial tissue in the joint. And then obviously lowering the inflammation, fixing gut dysfunction, because that's at the root cause of many things. And so then like this 3-pronged approach, just like getting after it, but it's all on the natural side. None of it's actually causing any side effects or downward effects. And so it's all just positive. And again, just like shotgun approach, like getting people like tremendous results with it, man. It's awesome. And so that's why it's like we're good at what we do. Like that's why we focus on what we do, right? Like we're not going to try to do something we don't know. And so it's like we focus on these three things and we just really, really optimize the way they work together. So again, it's like the three pillars and how they work together. It's like structure, function, regeneration. Like you're hitting all the bases, right? And so, you're not going to detox your way out of a structural problem. You're not going to rehab your way out of a toxicity problem. You need kind of a little bit of both, right? And so that's why the model works, because it's hitting it from all sides. And so, if you're listening and you feel like you've tried everything, how many times have I heard that? Oh, I've tried everything, or they tried everything. You probably haven't. And like, this is your sign to stop treating symptoms and really like start fixing problems, right? And so if you want to learn more about how we help diagnose, reverse, heal chronic disease within our functional medicine programs, go to alessifunctionalhealth.com, schedule a consultation with me or one of our providers, and let's create a personalized program for lifelong health. If you're listening to this podcast, you always get exclusive discounts and price reductions on all of our protocols, lab testing. Just make sure you mention where you heard about us.
And as always, if you found value in today's show, please like, subscribe, share this episode with someone who needs to hear it. That's how we get the message out and change more lives. And want to get in touch with us or be featured on an episode, email us at ask@alessifxhealth.com. Also, visit our website at alessifxhealth.com, sign up for our newsletter, and check out the resources page to learn more about our approach to nutrition and cutting-edge therapies.
And thank you again for tuning in to Health Decoded, where we break down the science, bust the myths, and help you take control of your health naturally. Until next time, stay curious, stay empowered, and remember, your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.